During this lecture, we'll discuss how to feed the adult horse during various life stages. Our goals in this lecture will be to learn how to feed adult horses at maintenance, gestation, and lactation. We'll then review the nutrient requirements of adult horses of senior age, and we'll end the lecture with a discussion about important nutrient toxicities. Before we begin, we'll review a general recipe that can be followed as you're evaluating a horse, their current ration, and then as you're formulating a diet that will be appropriate for the horse in whatever life stage it's in. You'll want to always begin by evaluating the horse's health. Determine whether weight gain or loss will be needed. Next, you'll do an evaluation of the horse's current ration, looking at the horse's diet history. What types of feed is the horse being fed? How much is the horse being fed? And then you can calculate the energy content of the ration. Using the NRC equations, you'll want to calculate the horse's energy requirement, and then you'll calculate the horse's protein requirement. Finally, you'll ensure that the horse has adequate water in its environment. You'll ensure that the horse has adequate dietary energy and protein in its ration. And then you'll make sure that there are adequate vitamin and mineral supplements provided as well. We'll begin with a discussion of feeding adult horses at a physiologic state of maintenance. Our nutritional goals at this life stage are to help the horse maintain an appropriate body weight and body condition score. We'll want to help optimize the horse's health by providing sufficient forage in the ration. We'll want to limit grain and concentrate feeds. We'll ensure that there are adequacy of all nutrients, including protein, essential fatty acids, as well as vitamins and minerals. And finally, we'll work to prevent disease by feeding good quality forage. And we'll also make sure that in all cases, gradual feed changes are made, which will help reduce the incidence of colic. We'll begin our discussion by looking at water needs of adult horses at maintenance. Adult horses require 30 to 60 mils per kg per day, and that works out on average to 13.5 to 27 liters per day for a 1,000-pound horse. This value will vary a little bit based on the individual animal. Horses obtain water from the feed that they eat, especially if they're eating pasture, which may be high in moisture. They'll obtain it from drinking. And finally, there'll be a small contribution from the metabolism of nutrients. In all cases, at least one water source must be offered, and ideally 2 water sources should be offered. It's important to provide the horse with clean, fresh water. If a horse is getting water from an automatic waterer, remember that oftentimes the horse will have a very small area with which to drink from. Automatic waterers can be prone to breaking, and if the horse is in a facility or a boarding stable, and if something has gone wrong with the plumbing and somebody has turned off the water source, there's a possibility, if it doesn't get turned on, that horses could be deprived of water. That's why it's always good to offer a second water source through a bucket or a trough. Remember that horses are prey animals, and instinctively they will not want to dunk their big heads into small little buckets where they can't see the horizon. In some cases, if you have a horse that doesn't like to drink a large volume of water, you may want to switch the type of bucket where the water is being offered. Many horses will prefer to drink from a trough where they have a lot of area and space and they can get water without dipping their head into a bucket. Other horses may prefer, according to owners, different colored buckets. There are a variety of different ways to provide water to horses. The important thing is to make sure that at least 1, preferably 2 water sources are offered at all times. Horses will lose water through a variety of normal mechanisms, including fecal water, urine, sweat. They'll also have evaporative losses of fluids, respiratory losses, and of course lactation. Abnormal fluid losses may derive from health problems like diarrhea, and there can be gastric residual fluids that in some cases can be as severe as to result in the loss of 90 to 100 liters of gastric residual fluid per day. Obviously, any fluid losses that are beyond maintenance will have to be provided through special fluid care. In horses, Water intake and feed intake are very closely linked. If a horse's water is restricted, then their feed intake will be reduced. Conversely, if a horse is deprived of feed, its water intake will be decreased. This can be illustrated by realizing that healthy horses at maintenance may need 30 liters of water per day. That same horse, when deprived of feed for up to 72 hours, may only drink 2 to 3 liters per day. That horse will be able to maintain their hydration by resorbing fluids from the cecum and colon. These parts of the intestine serve as a very large fluid reservoir for horses, and frequently when horses are deprived of feed or water, an impaction colic will develop within the colon. There are weather effects on the amount of water that horses will drink. Cold weather will decrease water intake in foals. High temperatures and high humidity greatly increase water intake during work in horses. Horses will drink less cold compared to warm water during cold weather. And if you have horses in a cold environment, in some cases it may help to provide warm water sources. Clients can actually purchase heated water sources, especially if they live in a very cold region. Again, remember the importance of adequate water intake in the prevention of impaction colic. As a field clinician, the vast majority of colics that you will manage are medical colics. Out of those colics, many will be impaction colics. And in many cases, if an owner can ensure that their horse is consuming adequate water at all times, then the incidence of impaction colics can be reduced. There are some strategies that can be used to help horses drink additional fluids. The first would be to flavor a water source. If your client does provide a flavored water source to a horse, then it's very important to ensure that the horse always has access to an unflavored source of water. Because if the horse doesn't like the flavoring that's been used, they will refuse the water. And if they don't have an alternate source, then they will stop drinking altogether. Water can be flavored with a handful of sweet feed, electrolytes, or juices like apple or cranberry juice or Gatorade. Obviously, if you have a horse that has problems with metabolism of glucose or sugar, you'll need to be cautious about the selection of water flavorings that you use. If a client does want to use a type of juice or Gatorade to flavor a water source, then remember that the amount added is only for a flavoring. You would never provide pure apple or cranberry juice or pure Gatorade to a horse. Instead, you'd want to use a small volume like 1 cup of juice to 2 to 3 gallons of water. Another strategy that can be used is to supplement the horse's ration with salt. Either non-iodized or iodized salt can be used. You'd want your client to gradually start supplementing the horse with salt with a small volume of 1 to 2 teaspoons once or twice daily. If the salt supplementation does encourage the horse to drink, then the volume of salt provided can be gradually increased up to 1 to 2 tablespoons per day. If the horse doesn't respond to the salt supplementation, it shouldn't be used. Although rare, if the horse does require sodium restriction, you would not want to use a strategy to encourage water intake. Next, we'll move on to a discussion of energy. Using the NRC equations provided in the first bullet point, we can calculate the energy required at minimal activity, like a horse sits resting in a stall, average activity, which is the equation we would use most often, or elevated activity, which would be used for horses that are more active, maybe they're pacing a stall. It would also be appropriate for stallions. These NRC equations are appropriate for all horses that weigh greater than 200 kilograms. Remember that 1 megacalorie equals 1,000 kilocalories, and many times in equine nutrition we'll actually speak about total energy needs in a day on a megacalorie basis. For horses that weigh less than 200 kilograms, and this might be the miniature horses that you may manage, you'd want to use the metabolic energy equation provided. That's metabolizable energy in kilocalories per day is equal to 132 times a horse's body weight in kilograms raised to the 3/4 power. All of these equations should be used as a guideline. Remember that the actual requirements for an individual horse will vary, and you'll want to assess the horse's body weight and body condition score as well as its current energy intake to determine whether or not the horse needs to be fed more or less to either gain or lose weight. If you're dealing with a horse that's described as an easy keeper, or a horse that gains weight easily, you may want to start using the average minimum equation as a starting point when determining how many calories that horse should consume in a day. Next, we'll discuss protein, and the NRC also gives us 3 different equations to use to calculate the protein requirements for an adult horse at maintenance. The average activity equation, which is body weight times 1.26 grams of crude protein per kilogram of body weight per day, is the equation that you will use most often in practice. A horse's protein requirements will usually be met if they're consuming a high-quality forage that's highly digestible and that contains between 8 to 12% protein. If the horse is consuming a ration that either has poor digestibility, or if the total protein in the forage is very low and the horse is not meeting their protein requirements, then you can supplement the ration by providing alfalfa hay, cubes, or pellets. You can use commercial supplemental or complete feeds to provide extra protein. And finally, you can use something like casein, whey, or soy protein in order to increase the protein in the horse's ration. Most horses at maintenance can thrive on a forage-only ration. It is important to always consider the vitamin and mineral composition of the ration, and I think it's useful to always provide a vitamin and mineral supplement to horses in one way or another. Purina Nature's Essentials Free Balance 1212 and Equaid Plus by Vitamix can be used as granular supplements. They provide vitamins and minerals, but don't provide excessive amounts of fat or protein. If a commercial supplemental feed is used in the ration, those will often provide extra protein and fat as well as vitamins and minerals. And in some cases, the calorie content of commercial feeds may be too high for a horse and will result in unwanted weight gain. Anytime herbal supplements or botanical ingredients are used in a supplementation program, you must use caution because some supplements may not be tolerated well. Horses should be offered a plain salt block in their environment. Treats can be used in the ration, but they always should be fed in limited volumes. If you have a horse that is overweight, a horse with laminitis, or a horse with a metabolic disease, you may need to be cautious in the type of treats that are offered. Carrots, apples, and bananas might be healthy for a horse at maintenance with no health problems, but they may not be appropriate for horses that have metabolic abnormalities. Commercial treats are also available, and in some cases, treats that have low concentrations of non-structural carbohydrates can be used. Another treat option that's possible for horses that have abnormal metabolism might be a product like Purina WellSolve LS, which is their low starch product, or a WellSolve WC, which is their weight control product. Both of those commercial feeds have very low concentrations of non-structural carbohydrates and could be used to provide a treat to a horse that otherwise might not tolerate higher levels of sugar or starch in their ration. It's important to always discuss appropriate monitoring and feeding of horses with owners. That would include teaching owners how to use a weight tape to assess the horse's body weight and teaching them how to body condition score their animals. It's nice to encourage owners to maintain a diet journal that they keep throughout the year. They can record body weight, body condition score information. They can note if they get a new shipment of feed or new shipment of hay. And in some cases, if a horse has colic, having a diet journal will allow you to review the horse's ration to see if you can find any possible causes for the colic that's developed. If you have a client that's feeding pasture, you'll want to evaluate the pasture for quality, the presence of weeds, and the stocking density of the horses. Too many horses on too small a piece of property may result in horses not being able to consume enough calories to maintain their weight. It's important to also ensure the safety of the horses in the pasture. Talk to the client about proper fencing. Also ensure that there are no hazards that are located in the pasture, such as tractors, farm equipment, wire, or anything that could be harmful to the horse. It would be useful to get a forage analysis if there's questionable pasture quality or to determine the highly fermentable carbohydrate content of the pasture. If you have a client that's feeding hay, you'll want to instruct the client on how to select quality hay if they don't know how to do so already. Teach them to avoid hay that has any mold or dust or weeds. And ensure that a forage analysis is done if you want to know the true nutrient content of the forage. Adult horses at maintenance should be able to thrive on a diet of forage alone, and the general guideline for horses at maintenance will be to feed 80 to 100% of the ration as forage. This will help decrease the risk of gastrointestinal complications, will help decrease excessive weight gain, and will be better for the horse overall. If a horse is out on pasture, it can be very difficult to define the amount of calories that they're consuming from the pasture. So I provided you with a few guidelines that you can use as a rough estimate to what the horse would consume. The amount of pasture consumed varies with the type of pasture as well as the length of the time that the horse is turned out onto pasture. You would expect that a horse that's turned out to pasture all the time would consume somewhere between 1.5 to 3% of their body weight on a dry matter basis in pasture grass. Horses that are turned out for 24 hours have a much slower rate of grass consumption, somewhere between 0.83 to 0.91 pounds per hour, compared to horses that are turned out for a limited period of time. This particular study looked at 3 hours, with an amount of 1.35 to 3.63 pounds consumed per hour for the limited turnout time. We'll next move on to a discussion of feeding horses at a life stage of reproduction. Our nutrition goals for feeding the breeding stallion and mare are quite similar to feeding horses at maintenance. We'll want to ensure that they maintain an appropriate body weight and body condition score. We'll ensure that they have adequate energy intake as well as adequate protein in their ration. We'll want to optimize their health by providing sufficient forage. We'll limit grain and concentrate feeds, and we'll ensure adequacy of nutrients, including protein, essential fatty acids, as well as vitamins and minerals. Finally, our goal will be to prevent disease at these life stages. When we consider feeding the breeding stallion, we need to think about their energy requirements being increased during the breeding season. And it's estimated that stallions will require 20% more energy during the breeding season. That will actually vary depending on the number of times that the stallion breeds, the number of mares that they're covering. Our goal as nutritionists is to want to get the stallion to maintain their body weight and body condition score throughout the breeding season. In order to do this, we'll want to feed a forage-based ration, and as needed, we'll add calories to meet the horse's increased energy needs. Fat can be used in the ration, and if you choose fat, you'll want to limit the omega-6 essential fatty acids and instead add something to the ration like flax, canola, or soy oil, which have higher concentrations of omega-3 fatty acids than corn oil. Commercial feeds can also be added to the ration, but as always, we'll want to limit the amount of grain, which would include feed ingredients that contain high concentrations of sugar and starch. Providing a balanced vitamin and mineral supplement is important to ensure that all nutrient requirements are being met. Breeding stallions can be supplemented with different nutrients in order to help promote sperm health and quality. Omega-3 fatty acids, specifically DHA or docosahexaenoic acid, is incorporated into sperm. It helps improve sperm motility and fusion, and also helps to protect against cellular damage that develops during artificial insemination. Antioxidants, including vitamin E and vitamin C, can decrease cellular damage. Carnitine may improve progressive sperm motility in horses that have poor progressive motility. Feeding the breeding mare again is quite similar to feeding horses at maintenance. We'll want to provide between 1.5 to 2% of the mare's body weight in forage. Pasture grass or hay would be appropriate. Our goal will be to have the mare maintain their body weight and also maintain a body condition score between 5 to 6. We don't want the breeding mares to get either too heavy or too thin. We'll want to limit the volume of the grain in the ration and provide a balanced vitamin and mineral supplement also. Omega-3 essential fatty acids may improve fertility in mares. That has been proven to be a fact in many other species. Next, we'll discuss how to feed the pregnant mare. Our nutritional goals for pregnant mares are to provide adequate dietary energy to meet requirements. Again, forage can be used in the ration, providing somewhere between 80 to 100% of the diet energy. Balanced vitamin and mineral supplements are useful to help ensure that the mare is meeting her increased requirements during pregnancy. Grain, concentrate feeds, and supplemental feeds can be added to the diet later in gestation when the mare's energy and other nutrient requirements increase, or they can be fed at any time if weight gain is needed. We want to make sure that our pregnant mares do not gain an excessive amount of weight, and we want them to maintain an appropriate body condition score throughout pregnancy. We don't want them to have a body condition score greater than 7 out of 9. We'll want our pregnant mares to have an optimal level of health, and obviously we'll want to reduce disease as well. Feeding mares up to month 5 of gestation is very, very easy because we feed them just like we would feed horses at a physiologic state of maintenance. So for water, energy, and protein requirements, they're exactly the same as for maintenance. Requirements don't actually increase in a pregnant mare until she reaches month 5 of gestation. So for energy, you'd use your maintenance energy equation. For protein, we're using the maintenance equation of protein for horses at average activity that was provided earlier in the lecture. The only two nutrients that do increase in early gestation are vitamin A and vitamin E, and the recommended NRC values are provided below. All other vitamins, as well as all other minerals, have the same requirements as maintenance. Many horse owners will think that once their mare is pregnant, they need to provide a lot of additional feed and supplements, but that just isn't the case. Requirements do not change for most nutrients until month 5 of gestation. So in the first 4 months of pregnancy, we'll want to provide the pregnant mare with forage as either pasture as hay as 80 to 100% of the ration. If high-quality forage is fed, then energy and protein requirements should be met with a forage-based ration. We'll want to feed a limited amount of grain, concentrate, or commercial feed if extra calories are needed. Supplemental feeds can be used to meet vitamin and mineral requirements, and a few suitable products are listed here. This is not an exclusive list, it's just a few products that could be considered. TDI 10, Nature's Essentials Enrich Plus, which is by Purina, Triple Crown 30, or LMF Super Supplement G or A. Note that G denotes a supplement that should be fed with grass hay. Those supplements have higher levels of calcium and higher levels of protein compared to the A supplements, which are designed to be fed with alfalfa hay. Those supplements would have a lower concentration of calcium and a lower concentration of protein. A plain vitamin and mineral supplement can be used in the ration of pregnant mares in early gestation in order to balance the ration. Next, we'll discuss how to feed mares in the last 7 months of gestation. Water requirements are very similar to maintenance. They may increase slightly due to the mare's increased intake of feed. As far as energy is concerned, we do expect the mare to gain weight as the fetus grows. And from month 5 on, we will need to feed the mare slightly more energy, somewhere between 0.5 to 1 megacalorie each month in order to meet her requirements. But that's still not a very high amount of additional energy that needs to be added. I recommend that you use the NRC computer program as a guideline to determine actual energy requirements during different months of mare's gestation. If you go to the website www.nap.edu and use the search word horse, you should be able to come up with the 2007 horse NRC book. And the free program that will do all the nutrient calculations is available on that site. All NRC recommendations use the assumption that a mare has a body conditions of 5 by the ninth month of gestation. If the mare's body condition score decreases, then increased dietary energy can be provided by up to 5% more. Your goal is to have the mare in a body condition score of 5 to 6 by the time she foals. The later pregnant mare will have increased protein requirements due to fetal, placental, and uterine protein needs. If a mare does not receive adequate protein in her diet, then she will use her endogenous stores of protein to support the growth of the fetus. The equation to use to determine the amount of protein a mare will need from months 5 to 11 of gestation is provided on this slide, but it's a cumbersome equation, and it's difficult to know all the different components, especially the fetal gain in kilograms based on the month of gestation. I'll recommend that you use that NRC guideline or that you look at the tables that are provided in the NRC book in order to get a best estimate of protein requirements. The lysine requirement is provided here as well. You take the crude protein times 0.043, so essentially you want 4.3% of the protein to be lysine in order to meet requirements. Macrominerals requirements do increase in later gestation in order to provide adequate minerals for bone deposition in the conceptus. Calcium, phosphorus, and magnesium requirements all increase by month 7, and they increase again starting at month 9. Note that potassium and sodium requirements don't increase until month 9 of gestation. The equations for requirements are provided here, but you can also use the NRC tables or the balancing program on the computer to get the actual values. Trace mineral requirements in some cases increase. They do increase for copper, iron, and iodine. For copper, between months 9 to 11, mares require 0.25 mg of copper per kilogram of body weight. Research has shown that providing copper to the ration of a late pregnant mare is actually probably important in helping foals repair OCD lesions that develop during growth. This was determined from a study that looked at mares that were supplementing with copper compared to mares that were not supplemented with copper. After the foals were born, liver copper concentrations were determined, and foals that had lower liver copper at birth had worsening OCD lesions from months 5 to 11 of age compared to foals that had higher liver copper. The foals that had higher liver copper at birth seemed to be able to repair OCD lesions much more effectively than the foals that were born to non-supplemented mares. Iron and iodine requirements increase. The equations are provided on this slide. There is no increase in the concentration recommended for cobalt, manganese, selenium, or zinc. Vitamin requirements for A and E remain the same throughout pregnancy. Remember, those are the only two nutrients that we said did have an increase in requirements once the mare became pregnant. Vitamin E plays an important role in later pregnancy. 2 studies have shown that mares supplemented with vitamin E during the last part of their pregnancy produced colostrum that had higher levels of immunoglobulins. So the mare's colostrum had higher IgM and IgG. Foals that then consumed that colostrum had better titers, IgG titers. And so supplementing mares in late pregnancy with vitamin E can help to improve immunity in the foal. Vitamin E supplementation is very safe, and it's a very inexpensive way to help promote not only the mare's health, but the health of the neonatal foal as well. The NRC does not show any recommended increases in vitamin D, thiamine, and riboflavin compared to maintenance, and the maintenance requirements are provided here on the slide. How do we want to feed mares in the last 7 months of gestation? We want to ensure that they have adequate water in their ration. We want to provide forage for greater than 80% of the ration. And as a mare is approaching gestation, oftentimes forage will not meet all of her energy and nutrient requirements. In those cases, we'll look to a commercial product or a grain and a vitamin and mineral product in order to supplement the mare's increased requirements. It's nice to pick a feed that you can use during late gestation and one that you can then transition the lactating mare into after she foals. If you use the same product in late gestation that you'll use in lactation, you won't have any new feeds being introduced after the mare foals. Remember, introduction of new feeds can occasionally precipitate a colic. Concentrate feeds that are commercially produced that would be appropriate for a mare in late gestation are provided here. It is not an exclusive list. There are just a few different products that a client may be able to feed. Enrich Plus and Strategy are Purina feeds. TDI 16 is a 16% protein feed. Triple Crown 30, LMF Development A or G are also suitable. If a supplemental feed is used, you definitely want to ensure that there's nutrient adequacy. At the same time, you'll want to avoid excess vitamin and mineral supplementation. Some clients will realize that certain nutrients are important for a pregnant mare and they will take it upon themselves to add extra supplements into the mare's ration, and they'll actually result in feeding the mare an imbalanced ration. So always evaluate the ration and make sure that it looks safe and that it's adequate for the mare during pregnancy. A very important point to remember is that herbal supplements should not be fed during pregnancy. The ingredients in herbal supplements, or these botanical ingredients, have not been evaluated for safety during the life stage of pregnancy. And you would accept liability if there was a problem like an abortion, or if there was a problem with the foal, if the client asked you if a particular product was safe and you had told them yes it was. So my general rule is to take out any herbal or botanical ingredients in a pregnant mare's ration. Next, we'll talk about feeding the mare during lactation. Our nutritional goals will be to provide adequate energy to prevent significant weight loss in the mare. Lactation is the most energy-demanding physiologic state, and mares may have up to 50 to 80% increase in their energy requirements. We'll still want to meet their nutrient requirements with a forage-based ration, but we will need to add supplemental feeds in order to provide extra calories and nutrients. Another important point is that we'll want to help prepare the mare for rebreeding. Mares that enter breeding with a body condition score of 5.3 ovulate sooner than mares that have less than a 5 body condition score. And a moderately fat body condition score does not seem to impair reproductive efficiency. Water requirements for the lactating mare are quite high. We would expect that because of their production of milk. And water intake may need to be 2 to 3 times maintenance. It'll be very important to ensure that adequate water is always available to lactating mares, and multiple sources of water should be offered. Lactating mares have high energy requirements. It takes into account not only their maintenance energy but also the energy needed for milk production. And the NRC makes calculations based on the assumption that a mare will enter lactation with a body condition score of 5. Looking at the 2007 NRC nutrient requirement tables for energy requirements, for instance, a 500 kilogram mare that may require around 15 megacalories at maintenance will now require somewhere between 31.7 down to 27.2 megacalories of energy from the start of lactation through 6 months of lactation. Early lactation is more energy demanding because of the composition of milk. Then it gradually decreases out to 6 months of lactation. Full growth does not seem to be affected by greater or less than 15% of the mare's energy intake. And if a mare is not provided adequate calories in her ration, milk production will still take precedence over her own body, and so she will catabolize her body stores of protein. She will utilize her reserves of minerals and vitamins in order to produce milk at her own expense. So the mare will lose body condition score. Her health could potentially deteriorate as she's producing milk for the foal. So it's very important to always monitor the mare's body weight and body condition score and adjust her intake as needed. I would even add that it's important to talk to clients about how they're going to feed their mares after the mare enters lactation well before the foal is born. Make sure that the client understands the importance of providing adequate nutrition to lactating mares, and then have a feeding plan in place so that once the mare foals, you can gradually adjust the ration in order to provide adequate calories as well as other nutrients. Protein requirements also increase for lactating mares, and the NRC equation is presented. It's very difficult to figure out the different components, including milk produced on kilograms per day. And so the NRC tables, or the balancing program on the computer, are the best to use in order to determine exactly what the protein requirements are. It's important to feed lactating mares high quality protein. We want to make sure they get the best forages available, the most digestible forages, because if we feed our lactating mares either poor quality protein, or if we don't feed them enough protein in their ration, then the mare will lose weight and body condition score, and the foal's growth will be adversely affected also. You can use different feeds to provide excess protein or additional protein in a lactating mare's ration, and feeds that contain between 12 to 16% protein that are commercial feeds. A few are listed here. As always, it's not an extensive list, but it does give you a few different ideas. Strategy and Omeline are both by Purina Mills, and then Triple Crown Growth is listed as well. It's always important to monitor the rate of consumption of supplemental feed by the foal to ensure that the foal is not eating excess energy. Many mares will push foals away and out of their feed trough, but other foals may be a little bit more dominant, and the mares will allow them to consume feed. That will result often in excess calorie intake by the foals, which can result in developmental orthopedic disease. Mineral requirements do increase during lactation. We'll just spend a moment thinking about calcium and phosphorus as well. Calcium will be resorbed from the mare's skeleton in order to provide adequate calcium for milk production if she's not getting enough calcium in her diet. Usually, once lactation is finished, then these calcium stores will be repleted. So all mineral requirements, both our macrominerals, calcium, phosphorus, magnesium, potassium, and sodium, will increase during lactation, and the trace minerals will increase as well. The NRC tables are the best to look at as far as a guideline about how much should be used in a ration. All you have to do is put in the mare's body weight and what month of lactation she's in, and then the computer program will calculate all mineral requirements for you. The requirements of vitamins A and D are the same for the lactating mare as they were throughout her gestation. But there is an increase in the requirements for vitamin E, thiamine, and riboflavin compared to gestation. The values are provided on this slide as well as in your notes. And the best way to determine the requirements for a lactating mare are to use the NRC tables or the program that's on the computer. How should lactating mares be fed? Number one, we want to always ensure that they have access to plenty of clean, fresh water. Next, we want to ensure that they're provided forage for greater than 70% of the diet. This is one of the rare life stages when we really do need to add a different type of feed to the ration, because forage alone at a megacalorie per pound simply won't provide the mare with either her energy or her protein and other essential nutrient requirements during her period of lactation. So in order to ensure that her ration remains balanced and that it's optimal, we want to supplement the ration with a grain, a concentrate feed, or a supplemental feed. And anytime we're making feed transitions, but especially in lactating mares, we want to make sure we transition her gradually onto the feed. It's ideal if a mare has been receiving a feed throughout gestation, that if she can be kept on that feed throughout lactation, then you're not making a feed change. Rather, often once she foals and enters lactation, then you can just gradually increase the volume of the supplemental or commercial feed that she's getting over a period of 5 to 7 days. It's important to ensure adequate vitamin and mineral intake, and most of the time if you're providing a commercial product that's suitable for lactating mares, then their vitamin and mineral needs will be met. And again, it's still worth mentioning that mares, not only that are in gestation but that are lactating, should not be fed herbal supplements. No information is available on how the botanical chemical ingredients are transmitted through milk or how they would affect the lactating mare, so it's best to completely omit them from the ration. Next we'll discuss fescue toxicosis. Tall fescue is a cool season grass primarily that's grown in the north and southeast. The wild type of fescue contains an endophyte that causes fescue toxicosis. This endophyte migrates up the stem. It localizes in the seed of the mature fescue plant, and so it's not visible. You can't just inspect a field of fescue to determine what's infected or not. But it's been estimated that up to 80% of wild-type tall fescue is infected. Fescue toxicosis will be a problem for horses that are consuming pasture, but it can also be a problem if horses are consuming fescue hay. It affects mares in the last trimester of their pregnancy and causes a variety of health problems not only for the mare, but also for the foal. There is a type of fescue called endophyte-free fescue. If you have a client that's interested in overseeding a pasture with endophyte-free fescue, or that's interested in taking the potentially infected fescue out of a pasture, it's best to consult a pasture management specialist. The toxic component that causes the clinical problems with fescue toxicosis are ergot alkaloids. They result in a decrease in plasma progesterone, estrogen, and prolactin in the mare. This leads to clinical signs including a prolonged gestation, a thickened placenta, and the thickened placenta can lead to many complications for the foal. The mare can have a dystocia, and so then the foal is adversely affected. There can also be a premature separation of the placenta, which can cause fetal hypoxemia. It can also result in abortion or stillbirth. Mares affected with fescue toxicosis can retain their placenta, which can be a life-threatening emergency in a mare. Mares may be difficult to rebreed. And finally, mares can develop agalactia. And if the agalactia can't be resolved, then the owner is left with essentially what's an orphan foal, and they'll have to manage the foal separately. Probably the best thing to think about fescue is it's very easily preventable, and that bullet point's at the bottom of the slide. We know that fescue toxicosis affects mares in the last third of their gestation, and so the best thing to do, and I would even recommend once a mare has become pregnant, is to take her off from a fescue pasture and take fescue hay away from her diet. We just want to decrease her exposure completely, then we don't have to worry about these problems. It's important to educate the owner if a mare has been exposed to the problems that could arise and to make a management plan that will be able to be implemented around the time that the mare is due to foal. If the mare has been fed fescue, then she should have veterinary care around the time she's ready to foal. That can be done in a few ways. One is you can have an owner monitor a mare closely, and as a veterinarian you could be on call to go out and assist the foaling. But in some cases, if it's a long distance for the veterinarian to travel to the mare, or if there's a concern about the mare and the foal's health, it's best to have the mare in a location where she can be very closely monitored, where somebody can be with her and to assist in foaling within 5 minutes. So that may be a mare being taken to a broodmare farm where they have stalls where the mare can be monitored, not only on a closed circuit TV, but where her labor can be monitored by using a foal alert. A less desirable option would be to bring a mare into a hospital setting for monitoring, but remember there are a lot of hospital pathogens that you really don't want any of natal foal to be exposed to. If that's your only option, then certainly mares can be brought into a hospital setting. The mare may need assistance with foaling, and so it's good that somebody can be around in order to help out immediately. It's very important to warn the clients about possibilities of complications with the foal. When the foal is in utero, everybody thinks that everything is going to go fine. Clients are willing, to do what they need to, but I think oftentimes before the foal is born, a client can make a more rational economic decision about how to manage the foal. If the foal is born and has birth complications, if it has hypoxemia, if it needs resuscitation after it's born, usually you'll be left with a foal that will need to stay in the PICU for an extended period of time. This can result in a medical bill for the foal that can be upwards of $10,000, $15,000, or $20,000. And a client needs to be aware of this going into the foaling, Obviously, as veterinarians, we always hope things will work out for the best, and most of the time they will. But we need to educate our clients about the possibility of having a foal born that has some critical care needs, and also the unfortunate possibility that the foal could either be aborted or that it could be stillborn. If the mare develops agalactia, then the dopamine antagonist domperidone can be used in order to try and stimulate milk production. The next part of our discussion will focus on the nutrition of senior horses. Senior horses can be defined in a variety of different ways, whether it be a chronologic age, a physiologic age, or even a demographic age. But for the purposes of our discussion, we'll think of senior horses as horses that are greater than 20 years of age. There have been minimal research studies performed on senior horses to learn their nutritional requirements, but a few have been performed, and we'll discuss those results of those studies in the next slide. When we think of energy and we think of older animals, and this is across species, older animals tend to have a decrease in fat-free mass. Another way of saying that is they have less muscle mass on their body. Energy requirements are related to the metabolic activity of different tissues, and that would include muscle. So it could be thought that because there's a lower muscle mass, the senior animal would require less energy. That tends to be the case in older animals and humans, but in horses it doesn't seem to be the case. In senior age horses, there's been increase in fecal energy measured, and that will suggest that there's a possible decrease in nutrient digestibility. By saying that there's an increase in fecal energy, what we're essentially saying is the horse is not getting as many nutrients from that hay as it did when it was younger. There's no exact known reason why this happens. It could be that there's a change in digestion in the large intestine. Maybe there's less efficiency in that area. There could also be a change in the ability of senior horses to masticate feed due to poor dentition. Remember that the feed particle size that leave a horse's mouth is going to be the same feed particle size that passes through in the manure. So if a horse isn't able to grind down hay or long-stemmed forage very well, then there's not as much surface area for the bacteria to work on when that feed then passes into the cecum and colon. Another question we need to think about is whether or not calorie restriction alters lifespan. In many species, dogs, primates, rodents, it's been seen that slight decreases in energy intake throughout the entire lifetime of the animal can promote a longer lifespan. And we're not talking about putting an animal on a severely restricted diet, we're just talking about slight energy restriction. In horses, it's very difficult to do this type of a study because horses can live to be 30 or 40 years old. And as new veterinarians begin entering practice, they're going to be seeing a greater population of senior horses because clients know how to help their horses live longer lives. Part of that longevity can be related to good overall health, and good overall health can be related to maintaining an animal in an appropriate body weight and body condition score throughout its life. So I think it would be reasonable to say that horses that are maintained at a good body condition score, around a 5 or a 6, probably have a better chance at living a longer life than horses that become obese and that are living in a body condition score of either a 7 or an 8 or a 9, because we know there are a lot of metabolic complications that are related to obesity in the horse. Senior horses do have a change in their protein requirements, although I can't give you a specific equation to use. We know, based on research, that senior horses have a lower apparent crude protein digestibility. If they can't get as much protein from their feed, they probably need some additional protein in their ration. Another study looked and identified a fact that supplementing the diet of a senior horse with lysine and threonine, those are our first two limiting amino acids for foal growth, supplementing with these two amino acids actually improved muscle mass and body condition score in older horses. That's a really interesting study, and I think if a lot of us think about what a senior horse looks like, we can think of the horse that has the sway back and a lot of muscle loss in the gluteal area and the epaxial musculature along their back. And if it's safe to supplement a senior horse with dietary protein, that's saying that they don't have renal disease and they don't have hepatic disease, that would be contraindications to protein supplementation, that it may be reasonable to add a little bit of extra protein to the ration, or specifically targeting lysine and threonine to try and improve the muscle mass. Micronutrient requirements are probably increased. Research has shown that there's a decreased apparent phosphorus digestibility, and it may be true for other nutrients as well in the mineral category. That digestibility is also lower in senior horses. So how should we feed our senior horses? As always, we want to take a look at the horse first. With senior horses in our evaluation, we really focus on dentition, as well as trying to identify any chronic disease in the animal. Problems with PPID, laminitis, chronic airway disease, all may be issues in which nutritional management could be beneficial if done properly. We want to make sure our senior horses are fed a high quality forage that's highly digestible. Grazing is ideal if the horse has good dentition. Many senior horses, if they've worn down their incisors with cribbing, may not be able to bite off blades of grass in a pasture. So pasture grazing may not be ideal for all senior horses. You'll have to evaluate each horse individually and decide what seems most appropriate. If you have a senior horse with poor dentition, or if the horse has had complications from colic, then it's reasonable to consider feeding a commercial complete feed or a pelleted hay. Complete feeds, as we talked, most feed companies do have these feeds, especially for senior horses. They do provide all essential macro and micronutrients to the horse, so no additional supplementation needs to be fed. Equine commercial feeds may also have a slightly higher digestibility. The one drawback of feeding commercial complete feeds to senior horses is that they can be expensive over a long period of time, and in some cases clients simply cannot afford to keep buying the feed that their horse needs. If you're dealing with a case where finances have become limiting for a senior horse, then what you can help the client do is to almost develop a very simple ration that closely approximates what would be in a senior feed. You can buy commercial pelleted hay, whether it be Timothy pellets or alfalfa pellets, or you can blend the two together. You can add a little bit of powdered protein to the pellets if necessary. You can add a little bit of oil to the pellets to add additional calories. And then finally, you can add a suitable vitamin and mineral supplement. So you can almost make a very inexpensive type of ration for a senior horse that then can be used to feed the horse for a long period of time. On the previous slide, we mentioned the benefits of adding supplemental protein to the ration. Again, that can be used as long as a senior horse doesn't have complications from hepatic or renal disease. It's probably a good idea to draw some blood on a senior horse before you start making any recommendations about dietary protein, just so you identify any subclinical renal or hepatic disease that just may not be showing up in a way that you can diagnose just from visually examining the animal. If the senior horse is just eating forage, then it is important to include a vitamin and mineral supplement. Remember, phosphorus digestibility is lower in senior horses, and some other nutrients may be as well. And as is the case for all horses, but especially senior horses, we do want to make all feed changes very slowly. A few comments about dentition. Routine floating is necessary for most senior age horses. Remember, you never want to file down the occlusal surface of the premolars and molars. You never smooth that out. All you're trying to do is take down points, resolve hooks, help out with a wave mouth, or if one tooth has grown abnormally long because there's no opposing tooth to help grind it down, you can help the horse to maintain good dentition. But another thing to remember with senior horses is you never want to make any dental changes too rapidly. It may take you a year, maybe a year and a half to get a senior horse's mouth a little bit better so it can masticate its feed more effectively. But anytime you make very rapid changes, you can actually hurt the horse. Some senior horses may either sustain jaw fractures, or I've seen cases where the dental work has been so severe that the horse is no longer able to eat, and unfortunately that would result in euthanasia if it's done improperly. So small gradual changes. Remember, these senior horses have learned to eat and survive with their poor dentition, so they're used to it. You have to make all their changes very slowly. It's important to monitor senior horses for infections and sinusitis, malodorous nasal discharge, either unilateral or bilateral, abnormal facial swellings. You can even have facial swellings that come around the orbit. We actually see orbital swelling due to tooth root abscesses that have tracked up through that region. Senior horses that have poor dentition, you can provide a highly digestible complete feed pellet or hay chop. Soaking pellets may be necessary for senior horses with very poor dentition. Sometimes it takes a while to train senior horses to like a pellet slurry or a mash. If some horses won't eat that right away, and sometimes you have to train them to like that. There are a number of different commercial feeds that are suitable for a senior horse. Almost every commercial feed company does have a product. As always, this is not an exclusive list. It's just a few different products that I've used previously. Equine Senior by Purina Mills, Triple Crown Senior, Triple Crown Horse Feed. Life Design Seniors by Nutrena, and then Senior is the product from LMF. In some cases, senior horses may abruptly go off feed, and sometimes they'll do this even if there's not a systemic disease to explain the change. If that happens, you may want to try switching to a different brand of a senior horse feed. You may also want to try adding some different palatable feeds to the ration to see if the horse would like to eat, maybe if you can tempt them. I've had clients grate carrots before, chop up very small pieces of apple, maybe adding apple sauce on top of a ration. Again, we're not talking about large volumes here. We're just talking about enough to try and interest the horse in eating, to remind them that they need to continue to eat. Some horses just seem to, if we anthropomorphize, they may become a little bit senile and they just don't seem to want to eat anymore. So in those cases, switch over the brand of feed and try and tempt them as much as you can. We'll finish our lecture with a brief discussion of nutrient deficiencies and toxicities that are important for horses. We'll start with a discussion of selenium, and selenium is a trace mineral that is important for antioxidant action. Glutathione peroxidase is one of the more well-known seleno-containing enzymes. Selenium can be measured through whole blood selenium or by measuring glutathione peroxidase activity in the blood. Of all the nutrients we think that horses require, selenium appears to be the most toxic nutrient. Horses can suffer from acute toxicity as well as chronic toxicity. Acute toxicity would include abrupt cardiac damage and it can be fatal. A number of years ago in the US, there were a group of polo ponies in Florida that were out on the playing field that dropped dead acutely. These horses had been given a parenteral injection that contained selenium, and unfortunately the compounding pharmacy that formulated the solution had an incorrect error in the amount of selenium that was included. So it was off by a factor, I think, of 10, and so the horses died acutely. It was a very serious issue. Chronic toxicity is more common, and if you're going to be working in the field of equine practice in your veterinary career, you're likely to see some horses that do have chronic toxicity. The maximum tolerable concentration in the ration of a horse for selenium is 2 mg of selenium per kilogram of dietary dry matter. Please note that this is milligram of selenium per kilogram of dry matter, not per kilogram of body weight. If we take an estimation that a horse will consume 10 kilograms of feed, which would be 22 pounds, this is your average 1,000-pound, 1,100-pound horse, using this calculation, that would put the maximum tolerable concentration of selenium at 20 milligrams. So it's a very, very low number. How can toxicity occur with selenium? Probably the most common problem that you will encounter is oversupplementation. Remember, selenium may be included in forages, although certain parts of the United States, West Coast especially, California, Oregon, Washington, have selenium deficient forages grown in selenium deficient soils. There are certain regions of the country where there can be higher levels of selenium accumulation, like in the Dakotas. But you may have some selenium in a forage. There may be some in a commercial feed. If a client is then choosing to use a vitamin E and selenium supplement, maybe they're adding another vitamin and mineral product into the mix, it can very easily become a problem if the client and if the veterinarian isn't closely watching all the different dietary supplements to ensure that the selenium concentration remains in the safe range. There are some areas of the U.S. again where selenium can accumulate in forages, the Dakotas being one area. Depending on where you end up practicing, if you're going to work in an area of equine practice, you may want to just get some idea of the selenium concentration in the forages that are grown locally. Selenium accumulator plants may be consumed by horses in pasture, although horses usually will avoid these types of plants. The time that they may end up consuming these plants is if they're on a calorie-restricted diet. Maybe you're doing a weight loss program for a horse. Maybe a horse is for some reason in a starvation situation, and so they're eating anything that they can eat, and they are consuming plants that they would otherwise avoid. Clinical signs of chronic selenium toxicity, again, which you'll see most commonly out in practice, would be broken mane and tail hair, as well as graying of the hair. Selenium will disrupt the disulfide bonds between cysteine and methionine, the two amino acids that help form hair. And so when those bonds are disrupted, the hair will break. And so a bobtail appearance is quite common when a horse has selenium toxicity. Laminitis can also develop, and it can end up being fatal. You'll often see a broken hoof wall. Again, these are fairly classic signs of selenium toxicity. Selenium yeast has a higher bioavailability compared to inorganic selenium, and there are many supplements as well as commercial feeds that do contain selenium yeast. It's an approved feed additive by the FDA. In some horses, it appears that the bioavailability of selenium yeast is so high that even if a horse is consuming an appropriate amount of selenium as selenium yeast, that they will still have blood levels of selenium that are in the toxic range. If you ever have a horse that's being treated with selenium, whether or not it's for a therapeutic reason, or maybe you're just trying to bring the level of selenium in the diet up to what you think should be appropriate, it's very important to not only know what kind of selenium is being fed, but then to monitor the horse with subsequent blood work to ensure that the selenium is not reaching a toxic level. In addition to toxicity, selenium deficiency can also be a problem with horses. Selenium deficiency presents as nutritional myodegeneration or white muscle disease. Just like with toxicity, selenium deficiency has two components, one being acute deficiency, where animals die of cardiac and respiratory failure, or chronic deficiency. Chronic deficiency can be seen in foals, where they present with weakness or stiff movement. They may only have a single presenting sign like dysphagia or a weak suckle. In certain regions of the country where forages are known to be low in selenium, many practitioners will proactively treat a newborn foal or a newborn ruminant with a injectable selenium, in order to try and ensure that selenium deficiency doesn't become a problem as that animal grows. If you ever have an animal that has developed selenium deficiency, again, usually you will see that regionally if a horse has been consuming hays that have a low concentration of selenium, and if they haven't been supplemented adequately, then it's important to monitor the whole blood selenium as the horse is managed with selenium supplements. You may have a horse present with weakness, they may have some muscle wasting. As part of your workup, you may do a blood selenium and see that the selenium is low. Then you'll make a supplementation plan. After you've done your supplementation plan for a month or two, recheck the blood, see where that horse is at. If they're still low, then continue the plan, maybe check in another month. You can make slight adjustments, but try not to provide too much too quickly. If the horse has become replete, then what you'll need to do is decrease that additional selenium in the ration, take it down a little bit, so you're still providing some, but maybe you're not providing quite as much, and eventually you'll find a way to taper the horse to a level of selenium intake that will allow them to remain repleted in selenium and will result in a normal whole blood selenium level. There's a practice problem that's included in the lecture notes. I would encourage you to try and work that problem through so you know how to make calculations to determine the selenium content of a ration or of a feed. Ionophore toxicity can be a very serious and life-ending problem for horses. Ionophore antibiotics are often included in ruminant and poultry rations to help improve feed efficiency. They include product names such as monensin, selinomycin, narasin, and lactulose. Horses are very sensitive to poisoning. And usually what ends up happening is that there's an accidental poisoning of a single horse or a group of horses or a barn that results from ionophore residues that have entered equine feeds from feed mills that blend both ruminant or poultry rations in the same feed line as horse rations. So let's say, for instance, you have a ruminant feed that's going through a feed mill and ionophores have been added to it. There can be enough trace residue of the ionophores within the mechanism in the feed mill that when you send a horse feed through following that medicated feed, that the residues enter the horse feed and then will poison and kill the horses. As with selenium, we see two different forms of ionophore toxicity: acute toxicity, which will result usually in cardiac signs, neurologic signs, muscle signs, and followed by acute death. But horses that survive an acute insult can have delayed health problems, and unfortunately, this often ends up ending the performance life of a horse. Horses that have had ionophore toxicity should never be used as performance animals. They can have cardiac damage, and they are predisposed to developing acute cardiac failure in the future. You don't always know this when this is going to happen, and if you have somebody riding a horse that has had exposure to ionophores and they do have some cardiac damage, even if it's subclinical, then they are a danger to that rider as well as anybody that's around that rider. It's important to test feed for ionophore residues. That's usually the way that outbreaks are identified. It can be a very, very serious health problem. There are certain commercial lines of horse feeds where the horse feed is only produced in factories where horse feed is manufactured. Purina Mills has one of those types of facilities. So Purina Mills never mixes horse feed in the same feed building as any ruminant or poultry feeds. Okay, they don't even, it's not that they just don't cross the feed lines, they don't even mix within the same building. So ionophore poisoning will be significantly less of a risk from a company that follows very strict protocols as far as the manufacturing of horse feeds. If you have clients that are using local or small millers to make their feed, it's probably worthwhile to see what their protocols and policies are to try and prevent ionophore poisoning. Recently, a nice training barn in Florida had 19 horses affected, and in the fall of 2015, another nice training barn in Central Valley in California, also I believe they lost 4 or 5 horses and had additional affected. So this is a problem that we do see. There are usually probably 4 or 5 outbreaks per year of ionophore toxicity in horses. So it's something to be aware of, and to try and again ensure that whatever feed horses under your care are eating, that it's as safe as possible. This ends our lecture. If there are questions, we can bring them up and discuss them in class. And you're always welcome to email me if you have any additional questions about the information that we've covered today.